Hello, this is Kelly Miners, and this is my final presentation for our class NU 6232, where I can talk about my aha moment that I had during this clinical rotation that we just participated in. So I want to give you a little bit of background. My clinical rotation was with a med-surg system educator, hospital educator in acute care. And so one of the projects that I did was I helped to lead a nurse residency program module, and it was the evidence-based practice module. So I want to give you a little background with research and myself. I went to nursing school and graduated in 2000. And from what I remember from my research class, it was not my favorite. I do remember doing a large research paper and looking at articles and kind of helping to decipher articles and studies and things like that. But it's been about 20 years since I have had a research class until I started this master's program about a year ago. And I have had one master's level research class, which really helped to kind of bring me up to speed what's gone on in the last 20 years, and to help open my eyes and kind of grow my skills in research. So this is why I have the haggard nurse running around, because research is a challenge for myself. So when I decided to be a part of this evidence-based practice module, um, I wanted to kind of look at some history of evidence-based practice in nursing. So our favorite nurse ever, Florence Nightingale, that has really changed our way of nursing, started evidence-based practice in the 1800s with her studies with hand washing and infection and things like that. And then it wasn't until like the 1970s until like the physicians practice really started to embrace some of that evidence-based practice and involving that into some of their order sets and things like that. And then finally in like the 1990s, nursing really started to embrace that in like the hospital setting and the acute care setting. So that kind of brings us up to speed with what I learned before I started this. I did this module with the nurse residents. And with the nurse residents, I had about 8 of them in there. And we went through a whole module on looking at evidence, how to look at evidence, how to rate the evidence if it was level A, B, C, D, or E, or a manufacturer recommendation. And we had to come up with a PICO question. So what they're going to do is we formed a PICO question, and then we have to look for articles and find articles and then make a presentation and then record a presentation for their nurse residency graduation. So just working with the students with this, that's when my aha moment started. So just putting a PICO question together. Again, it was the first time I formally had to do something like this, because when I went to nursing school, I don't remember doing this at all. So what I learned in my past research class and just reading some articles to get me up to speed kind of helped me look at it from a different set of eyes. So I feel like as an undergraduate, I looked at more like, oh, this is something I have to do. I don't really understand the value added. And now as a mid-master's prepared nurse, I'm learning about how this really um, and encompasses what nursing is and the discipline in nursing. It also really helps to improve our safety and our patient care. So the PICO question that we came up with has to do with patients with urinary retention. The intervention is multiple intermittent catheterizations and UTI rates. The comparison is UTI rates with patients that have an indwelling catheter. And uh, the predictive outcome is patients that require multiple intermittent straight catheterizations due to urinary retention have a decreased rate of UTI versus patients that have an indwelling catheter. And again, I would not have been able to put all this together as an undergraduate. So I feel like I'm really embracing some of the things that we have learned in this class. So this goes on to kind of correlating the aspects that we have been learning about. So the AACN Masters Essential 4, translating and integrating scholarship into practice. So when I read over that and read about it, recognizing that the Master's Prepared Nurse applies research outcomes with a practice setting, resolves practice problems, and works as a change agent and disseminates results, I had another aha moment then. Like, yes, this is what we're doing. This is how we're putting everything together. This is what we see the problem is, and this is how we're going to try and take care of this problem. And we're not going to do it because this is how we feel it should be done. We're going to find the best evidence-based practice, evidence-based research that we can use to back this up to try and change, like, should the patient have an indwelling catheter, or is it okay to intermittently catheterize these patients without increasing our infection rates and causing harm? Then looking at the QSEN aspect of this class that I know I have used in every one of my posts. And when I looked at that, what really resonated was demonstrating knowledge of health research methods and processes. So go into further with that is to describe evidence-based practice to include the components of research evidence, clinical expertise, and patient and family values. So I feel like this project really embraced that, because we are looking at the research and the evidence. We're looking at the clinical expertise by finding and creating that PICO question, excuse me, and the patient values. We don't want to cause harm. We don't want to cause more infection or longer length of stay for these patients. When I wrote about this during one of my logs, Dr. McDermott introduced me into the nursing professional development standards, and she guided me to this article that was very, very helpful. And I think that was probably my third aha moment into this project, where uh, it just kind of helped solidify and articulate all of the things that we have been trying to do. So, Standard 9 is evidence based practice and research. So, to explain that a little bit better, so nurse professional development practitioners act as champions of scientific inquiry, creating new knowledge and incorporating the best available evidence into practice. So that's what this was all about. So the undergraduate and the nurse residents are not able to do this, but the master's prepared nurse is able to articulate and put all of this together in order to create a very substantial project. So again, my aha moment was working with this nurse resident group with their evidence-based practice, managing that, going through all the different levels of evidence, how to find the evidence, and how to put things together with our formulated PICO question, and how that could really affect practice, um, increase or have better patient outcomes, and to teach this method so that these nurses can learn to do this in the future and they can constantly be able to use this to improve practice. And all of this will bridge the AACN, QSEN, and the nursing professional standard development standards, thus making it a very strong project for a master's prepared nurse. Here are my references. Thank you for listening, and good luck on all the rest of your projects. Thank you.